So a sonographer is a person like me that uses ultrasound equipment to get live images from inside your body. We scan on top of your tummy, and sometimes we can scan internally as well to see what your baby's up to inside. So as sonographers, we're trained to look for normal variants throughout the baby. So we're looking through your baby for any structural abnormalities. If something doesn't look quite right and we're a bit tweaked by it, what we'll do is we'll look into it in more depth, and sometimes we'll often get a second opinion. But basically we're looking for viability, making sure the heart's pumping away, and any abnormalities that we can see on the day. For pregnant ladies, generally most women have about 2 scans. Your first scan is around about 12 weeks when in pregnancy. That's when we're looking to diagnose the heartbeat. We're looking to see how many weeks you actually are. We're looking to see if there's 1 or 2. What we're looking for then as well is we can offer you Down syndrome screening, where we use a probe on top of your stomach to take a measurement at the back of the baby's neck, and we're looking at the fluid at the back of the baby's neck. That can go towards your combined testing for Down syndrome screening, where you'll get a risk factor to let you know if you're high risk or low risk for Down syndrome. We're also looking out at your ovaries to make sure that they're functioning well. Your next scan is when you're around about 18 to 20 weeks. This scan is called an anomaly scan or a detail scan. Now for this, we have quite a lot of checkpoints to look through. So we've got to look through the baby's brain, the body, the spine, arms, legs, heart beating, eyes, everything you can imagine we have to look for. We basically have a checklist we have to go down. At the end of this scan, we can also let you know what the sex of the baby is, but you must all remember, guys, that we don't see everything on an ultrasound. We try as very best for you, and sometimes we can get things wrong, or we don't always see things. They're not always basically there in front of you at 20 weeks. Things can develop later on in pregnancy. If you do go for another scan, it's another scan called a growth scan. This will happen later on in pregnancy, where we measure the baby's head, tummy and leg. We'll look at the Leica volume, which is the fluid around baby, making sure there's enough around baby. And we can sometimes do something called a Doppler, which measures the blood flow in the baby's cord, just to make sure the baby's getting enough from the placenta and that's functioning properly as well. Not all ladies have this. It depends whether you're classed as maybe a high risk pregnancy, or your midwife asks for another one, or your consultant asks for another scan. So don't be worried if you don't get one. Equally, don't be worried if you do get one. Sometimes some ladies will do early pregnancy scans, so if you're very early on in pregnancy, we can detect a heartbeat from about 5 to 6 weeks. If you've been having any bleeding or any pain, we can do a transvaginal scan, where we look inside your vagina a bit close towards the baby, just to see what's going on at that many weeks in your pregnancy. So what we'll do is, prior to your scan, we'll call you into an examination room, then we'll introduce ourselves to you, and then we'll ask you to lay down flat on your back on a bed. Your partner generally sits, or your friend or your family member sits at the side of you. Then what we'll do is get you to lift up your top halves, just lower your bottom halves ever so slightly. We'll stick some jelly on your tummy, which happens to be cold where I work, but in other places it can be quite warm. And then what we'll do is we'll then start scanning on top of your tummy. And as soon as we get a heartbeat, we'll turn the screen round and show you the heartbeat, the heartbeat pumping away and the baby. So to begin with, we'll only ask one person to come in the room with you, just because we've got a lot to concentrate on. At the end of the scan, if we think that everything is alright, what we can do then is invite other friends or family members in the room with you, and then we can go through baby with all of you all at the same time, so you can all have that bonding experience together. At the end of the scan, when we're happy that we've seen everything and we've shown you through baby, what we can do is get you some images of baby's face, which is a nice keepsake for you. We'll also give you a report, and on the report it'll give you all the points that we've checked and all the things that we've gone through, just to say that we're happy that we've looked through baby, that we haven't detected any abnormalities. But obviously you've got to bear at the back of your mind, guys, that we don't see everything, and we do try as very, very, very best when we're scanning you.